Hi, today I'm going to be assessing the patient's cardiopulmonary systems. I would start by inspecting the patient's chest. I would note that his ribs are downward and symmetrical, his ab muscles are appropriate for his age, and everything looks symmetrical. His clavicles are good. And then I would look at the posterior back, and I would notice that his spine is aligned and his scapulas are symmetrical. His ribs are again downward and everything looks good. Let's sit down. And then I will note symmetrical chest expansion. And this is just to ensure that the lungs are both filling symmetrically on both sides. So I'm going to do that on the front first, and I will start by having my hands on the costal margins and my thumbs towards each other, and when the patient takes a deep breath, my hand should move apart symmetrically, and that indicates that the patient is having symmetrical chest rise. So I'll ask him to take a deep breath. Again. And my fingers are moving apart symmetrically, so that's good. And you can do it on the back as well. You place your hands sideways and on T9 or T10, and have the patient take a breath. Okay, and your fingers are again supposed to move out symmetrically. You can sit down. And then I'll do the tactile phimitis, and I'll do this by using the ball of my finger. I'll start above the clavicle, and I'll have the patient say 99, and I should feel symmetrical vibrations bilaterally. So when I touch you, say 99.
99. 99. 99. 99. 99. 99.
Okay, and that was all symmetrical. And this entire time I've been palpating for any masses or any tenderness, and he doesn't have any masses. Do you have any tenderness? Okay. And then I am going to percuss the posterior side of his back. So I will have him, you can turn around and sit down. And I will do this by placing my fingers in the intercostal space. Placing my fingers in the intercostal space. My middle finger is where I'm going to be tapping, and this hand is just kind of loose, and you're supposed to check it you'll check both sides and compare them. So my fingers in the intercostal space. And both sides sound the same. They have a resonance, which is good. And then I will auscultate his breath sounds. I'll have you turn around again. And his lungs sound clear on both sides. You always want to compare side to side and make sure that you move laterally so you can hear the base of the lungs. And I will also the next 3 tests I'll be doing are to check for consolidation in the lungs, and this can be like a place of fluid in the lungs or a sign of pneumonia. And the first test I'm going to be doing is bronchophony. And again, this is just to detect fluid or pneumonia. And I will do that by having the patient speak 99. And when he does this, I should not be able to hear it clearly. It should sound really muffled, and I shouldn't be able to tell exactly what he's saying.
99. 99. 99. 99. 99. 99.
Okay. And the words he was saying were really muffled, and they weren't really coming out as clear words, so that's good. That means that there is no consolidation there. And then I will do the whisper test, which is also testing for the same thing, but this time I'll have the patient whisper 1, 2, 3. And again, I shouldn't be able to really make out what he's saying.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, good. And the final test I will be doing to check for consolidation is egophony. And this is, he will say, the patient, when you place the stethoscope, will say E, and if it sounds more like A, that means that he does have consolidation. So when I place the stethoscope, just say E.
E. E. E. E. E. E.
Okay. And it all sounded like E, so that's good. Then I'm going to move on to checking his heart. And I'm going to start by auscultating. I'm going to first auscultate the aortic valve, which is on the right second intercostal space, and then the pulmonic valve, which is the second intercostal space on the left, and then the tricuspid valve, which is the lower sternal space, and then the mitral valve, which is the fifth intercostal space. And I will listen with my diaphragm first, and then the bell of my stethoscope. So this is the aortic valve. Pulmonic. Tricuspid. And mitral. And his heart sounds good and it's regular. And then I will listen to his apical heart rate for a minute. And I checked it earlier and it was 82. So then I'm going to palpate his carotid. And then I'm going to auscultate it, and when I'm auscultating it, I'm going to be listening for a bruit, which is kind of a swishing sound, and it indicates cardiovascular disease. And when I listen to the carotid, I'm going to use the bell of my stethoscope. And the carotid is absent of a bruit, so that's good. And his heart was regular and sounded good. Lungs were clear on both sides, and that would be the end of my assessment.